We have an important health alert to tell you about this morning. It is an incredibly common disease, and it can start quietly, sometimes with no symptoms at all. We're talking about gum disease. According to the CDC, nearly half of adults over 30 are showing signs of gum disease, and 9% have a severe version called periodontal disease. The longer that this condition goes without medical intervention, the harder it becomes to treat. Some people can end up losing their teeth because of it. Researchers have also linked it to dementia, diabetes, and heart disease. So it's serious. Dr. Chris Pernell, public health physician and regent at large for the American College of Preventive Medicine, is here to talk more about it. So there aren't really signs or symptoms to gum disease. What should we be looking for then?
Morning, Marni. So let's start with prevention, right? Because that's a very powerful tool. Are you brushing your teeth twice a day and flossing regularly? Those habits are protective. In addition to having those effective oral hygiene habits, do you notice blood occasionally when you are brushing or you're flossing your teeth? Is there a family history of gum disease or gingivitis? Do you grind your teeth at night? Do you take certain medications that might predispose you to develop the inflammation of your gum line? Those are things that a person can look out for, especially the healthy habits.
Okay, and oral health can lead to other health concerns, like we said, dementia, even heart disease. What is the link between taking care of our teeth and the rest of our body?
It's bacteria, right? You have plaque on your teeth that are bacteria. Those bacteria can release harmful and irritating substances. Those substances can attack the gum line. That inflammation can then be throughout the body. We know that inflammation, typically we think of it as a negative when we're thinking about our health and well-being. The most important thing, again, for people to understand is that you have one body and it's all connected. The head is connected to the limbs, the chest and the trunk, and the mouth is important. So don't ignore any area.
Yeah, head, shoulders, knees and toes, knees and toes. And periodontal disease, it's not reversible, right? So once the damage is done, it's basically maintaining it and keeping up good oral hygiene?
So basically, you want to limit it. You want to limit the progression of worse damage. If you have severe periodontal disease and you have gum lines that are receding, if you have tooth loss or very discolored gums, those are things that usually cannot be treated unless you're thinking about repairing the gum with some type of antibiotic if necessary, if there's an infection. But again, prevention is where we can get the most benefit for our well-being.
Yeah, I've been told I'm an aggressive brusher, so that's one thing I'm working on, right? It's not good. It's actually not a...
Don't be too aggressive.
Yeah, it's not a good thing. Actor Tyler Labine had a blood clot recently. It could have killed him. This actor opened up about the ordeal on Instagram. He said he first dismissed it as a stomach ache. However, it was so severe, he went into the ER. He was diagnosed with a blood clot in his intestines and liver. He says he's doing all right. He previously was hospitalized in November to fix a hernia. So the question we want to know is how you can tell when a stomach ache is more than a stomach ache, because I think a lot of people, you'll ignore it, right? You'll think it'll pass. In his situation, I'm very thankful he didn't.
Very thankful that he didn't. So blood clots or deep vein thrombosis, they can occur anywhere in the body. Blood clots in the stomach or belly or abdomen area are rare. If you have severe abdominal pain, if it comes and it goes, perhaps you have fluid or distension of the belly, that's called ascites. Maybe you'll have bloody diarrhea or you have nausea and vomiting. That constellation of symptoms is something that should cause you to say, hey, I need to check in with my provider. Or if it's pain out of proportion, the pain just won't stop no matter what you do, report to an emergency room so that you can be thoroughly examined and causes for your symptoms can be found.
How do they treat blood clots?
So it depends, Marni, where the blood clot occurs. So basically, you do take blood thinners or anticoagulants. You can have an injection, you can have a pill, or you can have an IV form. If the blood clot has traveled and it's somewhere in a very auspicious space, it's life-threatening, that's when you might think about direct application of a blood thinner or even surgery to remove the clot.
And in his case, he had a surgery for hernia. Is it likely the two were linked generally after a surgery or a medical procedure?
That's hard to say given the time period. I believe he had his surgery to correct his hernia back in the fall. But typically, if you have had a recent surgery, if you have been immobilized, a very long plane flight, if you have prolonged bed rest, if you're a smoker, if you're pregnant, if you take certain medications like oral contraceptives or hormone replacement therapy, you could be at risk for developing a blood clot.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.